Hey everyone, welcome to another episode of Scrubs and Software. I apologize for not recording one of these in a few weeks. Obviously, with the holidays, couldn't the last few weeks of the year, and then it's been a super busy start to the year, but happy to be doing one with BloodGPT today. Before I dive into this, just want to put it out there. If you're watching this and you have a cool AI tool or app or some type of tech product you want me to review or do one of these around, happy to do so. Send me a message here either on LinkedIn, or my email is pretty easy to find. Also want to point out that I did record a podcast with Jonathan, who is the CEO of BloodGPT. That will be coming out next week, where I go into more detail about the solutions they're trying to offer, their roadmap, and their origin story. So be sure to stay tuned for that. But this is a really cool solution, in my opinion, for what we all have envisioned as personalized healthcare enhanced by AI, right? We all get blood work. Sometimes you get good insights into it, sometimes you don't. This essentially kind of equalizes that, gives everyone an equal amount of initial access. You're obviously still going to need clinicians to act on those prescribed medications and make sure that the right things are happening. They are basically a platform where you upload your lab results, gives you insight, and we'll kind of go through some lab results that I uploaded. So initially, when you create an account, this is what everything looks like. What you do is you upload your test. So I've kind of created a profile here. I uploaded my test already, but you essentially can drag a PDF and upload a PDF. It takes about 3 to 5 minutes. It would come kind of right here, and then it kind of organizes that. I only have one set of lab results that I uploaded, but where it works best, where I was looking at the demos, is if you have, like, say, 5 years worth, and then it can kind of trend things out for you and give you better insights. The other thing I really love is that we obviously in the US have a very fragmented healthcare system. So you may have a different primary care doctor, depending on what your insurance covers or not, or they may start using different labs. And so you're going to get all types of different PDFs, different portals, hard to track that information. And so you could download the PDFs and simply upload everything here, and that'll make things easier to track. So I'm going to come here. And so initially when you upload stuff, it'll kind of lay it out like this. I kind of like the cards view, where it kind of shows you things that are in and out of range. And so this is kind of gives you a quick picture of how things look. But I think where obviously the real power of this comes is when you go to view report. And so it'll obviously tell you what's in range, what's not in range. And what I really like is, so you kind of come here, right? And so my ANC count is slightly low. Now, this is not clinically significant. I will preface this with, this is the new challenge we will have with AI, right? So more patients are going to be using tools like this. There's obviously other companies launching products like this. And so there are going to be obviously some patients where they see something like this. Now, I, as a physician, know that, this ANC being slightly low or my white blood cell count being 3.4 is not clinically significant, nothing to really worry about, looking at it in the context of the other results of the CBC. A patient may, not see it as that, and they may be rushing to an ER or an appointment when they see something like that. So that is the one downside to giving access. But from my perspective, the more access, the better. The more accountability you have for your health and what values you have in tracking things, the better. But so what I like here is, for example, it tells me this is low. Then it tells me exactly what this means, right? So participates in immune defense as a measure of how many neutrophils are circulating in the blood. You can then also click on learn more. So I'm just going to actually focus on white blood cell count. You can click on learn more, and it's got this little kind of chat bot that comes out, and it starts to kind of tell you stuff, right? So it says my WBC is flagged as low. Prior value, if you had it, it would show it there. And then it kind of goes to what are the primary functions of white blood cells in the body, why white blood cells is important for general health. And you kind of keep going, and it gives you a conclusion summary of everything. And so you compare this to what you get now, right? So a lot of us go to labs. We pay for labs out of pocket, maybe because you're really health conscious, and you'll get like a 2-liner and something that's in range or out of range, and that's basically it, right? You can actually interact with this and click into things and ask it questions, which is really cool. Then it even kind of lists out priority tests that were not part of my panel that maybe I should get. It's saying that I should do follow-up testing in 4 weeks and in 6 weeks, which is really nice. And then this feature, which I believe is not fully launched yet, is meal plans from your blood test results. So as I mentioned, it's not launched yet, but you can click on it and then get insights into, say, my cholesterol was high. It'll tell me, what that means. So with me, my cholesterol is actually interesting, right? So I have some values. My LDL is, slightly high. Cholesterol is like upper limit of normal, but then you look at my ApoB, which is within normal range. And so what I like to do, or what I saw that was interesting to me, is when I asked on it to kind of tell me more. So it's telling me your cholesterol is 192, so upper limit of high, right? But still within standard range. And then it tells you like why it's important. And then it says here non-HDL cholesterol and ApoB are other kind of interesting things to keep an eye on. And so I'm someone who's kind of, maybe a little too obsessed with these things. And as we know, ApoB is kind of the particle that actually causes the damage to the endothelial wall and causes the issues. And so I love that it kind of brings that into the picture and adds it into the discussion. Quite frankly, for example, my parents will go to primary care doctors that are older. They're not regularly testing ApoB. Now, that's obviously not a recommendation or anything that comes down from guidelines, but we're now learning more and more that that is essentially something that is almost equivalent to an A1C when you're looking at cholesterol levels. And so I see this as, someone who's maybe a younger person who isn't going to a primary care doctor every year. Maybe they get blood tests. Maybe they plug it into this and they see these terms like ApoB and whatnot and ask their doctor, hey, should I be testing this? Is this something I need? And they can have that conversation with their physician. And so just more accountability there and education for oneself about your results. And then obviously the diet portion, kind of as I mentioned here, is a whole other tab that you can kind of get things on. One other thing I wanted to really quickly go to, let me see if I can find it. I just wanted to show the PDF upload of what I had actually uploaded, and there was a way to see it. I believe, oh yeah, view report, I think is where you click on it. And then there's a PDF. So this is what my labs look like, right? So this is some lab that is contracted to Quest, and I paid for these out of pocket. And look at just how kind of bland it is. And, you can't click on anything, gives you some basic lines. For a lot of things, it doesn't even tell you what it is or what it isn't. And, if you're a clinician, no big deal. You kind of know what things are. But obviously, like here's the perfect example. My white blood cell count is 3.4. So now imagine if you are, just the average person, you're not a physician, a nurse, a PA, nothing like that. You are going to be wondering, what is this? When you Google a low white blood cell count, obviously you're going to see some scary things, cancers and things of that nature. And so then it's going to cause an unnecessary freak out. Now, obviously, anything that's abnormal, you're still going to want to see a doctor, make sure that, things are okay. But this, within its kind of platform, is going to explain exactly what that is to you. And I think it's going to kind of lower that initial alarm and freak out level. That being said, not a substitute for medical advice or anything like that. I think this is a really interesting tool where we get so many blood tests done in the United States and globally. Some of them you get good insights on, others you don't. Primary care doctors are really slammed. And so getting some of that initial, shock value out of it, seeing what lab is abnormal, what things that I can do are to fix those potentially. And this does a good job of that, having that chatbot and whatnot. And then kind of continuing that conversation with your physician. And you can ask this questions as well. So this isn't just like a one-time thing. You can type questions down here and say, like, what can I do to make my WBC count normal? I'm curious what it's going to say, but that is kind of a really cool thing. So I go into a lot more detail with regards to what the company itself sees as the problem that they're trying to solve, what institutions and organizations they're trying to partner up with. And so stay tuned for that podcast episode. And then once again, if you have any tool or anything like that, I love getting my hands on these tools, love playing with them, love providing feedback. And looks like it gave me an answer for confirm if it's real, a persistent pattern, not a one-off. once again, we get patients who come to the ER all the time with abnormal labs, and the first thing we do is confirm that. And for example, hemolyzed potassium, usually it's high outpatient at a lab they had it done in. They come in, potassium's normal, nothing to do. And then it kind of gives me vitamin B12 and folate, other things that I should be thinking about. Reduce physiologic stress load, minimize infection burden. So some of these things are, very practical things. Other things are kind of, more a differential that you could look up on Google. But once again, it's giving you actionable steps and guidance. So just wanting to create this cool episode, many more coming this year. And thanks for tuning in as always.